Okay, good.
Are you ready?
I'm ready. Yeah, of course I'm ready. Hi, so here we are at the Ben and Gary Show. Ben can't be with us today, but...
it's the Dan and Gary Show today.
Yeah, Dan. Right, so... But we had a question come into us, and that question was, when should a young adult transition from a pediatric practice to a adult practice?
Mm-hmm.
I thought that was an interesting question, and so we're here to answer that today. So I think first we should just talk about, well, what is a pediatric dentist? What do they do, right? So
what makes them different from a general dentist?
Right, yeah. So a pediatric dentist, I think they train for 2 years, and they treat young children and children as they transition into their teenage years and on into their young adult years. But they have special training and techniques on how to treat the developing dentition for these young children. And so they also treat special needs children. And again, all this is, comes from their training. But it's usually 2 years.
Mm-hmm.
Yeah.
This is not even like the dentistry so much as kind of like creating a nice environment,
right?
And that kind of aspect as well.
Right.
I mean, also like you're saying, the transitioning dentition, their teeth are going to change, and so they know a lot about that,
right?
Too.
Well, I tell you, I've been to like the orthodontist that I took my children to.
Mm.
I mean, he had a lot of like video game stuff, and it was kind of a fun little play area.
Right.
And
especially when kids are like waiting, they can't wait too long.
Yeah.
So they need something to occupy.
But the patients that we've received from these pediatric practices, I mean, they love their dentists, and you think about some of the older adults that we have, older adult patients,
mm-hmm.
who had such terrible experiences with their childhood dentists,
right?
And these were probably just general dentists who weren't really trained on how to work with children, and they didn't have much patience with treating kids, and so it was made for a very bad experience. So, and sometimes of course back then they didn't use local anesthesia, so
right.
They
taught you how to treat the teeth, not the
right.
face around it, right? So.
Oh yeah, so that's why some of the older adults have very bad childhood memories of dentistry.
But it's probably the benefit of going to a pediatric dentist.
Exactly, yeah. And pediatric dentists, they just make things so much more fun for the children, and they just know how to talk to them and deal with them on their level, on the kid's level. So they know how to put the carrot out there to make the child do what they need to do.
Mm-hmm.
And it's very interesting though.
Right.
But,
so when do you think they should switch to a more traditional, general dentist, adult
mm-hmm.
dentist?
Yeah, I don't think that there's a set age. In looking through some of the articles that we've read, I think it's really done on a case-by-case basis, don't you think?
Mm-hmm. I mean, as a general rule, maybe like by the time you have your wisdom teeth, you should maybe start thinking about it. You have all of your adult teeth at that point,
right?
But maybe if they like their pediatric dentist,
they probably. I mean, I know that some of the kids that we get have said that they stayed with their pediatric dentist through college.
Mm-hmm.
But
they don't want to worry about finding a new dentist. They like who they're with.
Right. But I've also had some kids that have come to see us because they felt like they had outgrown the pediatric dentist.
Right.
The office, and they just didn't want to be around all the little kids. So
the mature 17-year-old.
Yeah. But there are some instances that you had mentioned earlier. About
Like I've seen the patient.
They have to come to us a little bit sooner, so you may want to talk about that.
Yeah, it was a 15-year-old patient who was missing. It was two, not the central teeth, but the lateral teeth, the ones next to the centrals, which is probably one of the more common teeth to have missing.
Right.
So after orthodontic treatment, they needed the prosthesis. They're too young to get implants.
Right.
You get implants typically when you're 18 or older.
Right.
When you're mostly done growing. I mean, you keep growing as you age, but so he needed something in the meantime. So he needed a prosthesis. So the orthodontist referred him over here. He also has a pediatric dentist too.
Yeah.
So, but he needed something else. So, I mean, he was only 15, so he needed something sooner.
Right. So you have special cases like that where that transition has to be made a little bit sooner than normally.
Right.
So, but anyway, that's a good point. Is there anything that we missed, do you think?
No.
Well, let me take a sip out of our Smiles International cup, because I think that's what we're here for, right?
Shameless plug, right? Yeah, I mean, like I was saying, pretty much like around the time you have wisdom teeth.
Yeah.
And that's something like a lot of pediatric dentists, like I've had pediatric dentists talk to me about, planning if you know that they're missing a tooth, you can see that there's no tooth forming.
Right.
Like as they're growing, you can start planning. Okay, what are we gonna do?
Yeah.
And so talking to a restorative dentist or a prosthodontist, talking about what's gonna happen in the future.
Yeah.
But yeah, around the time you have wisdom teeth, you're pretty much kind of fully grown at that point, so you really don't necessarily need to see a pediatric dentist. But you mentioned special needs patients too, that may want to stay on longer with their pediatric dentist.
Yeah.
Right?
No, I think that's a good point, because that's part of their training.
Right.
And that's certain. I didn't get any training in that. Did you?
No.
So
not too much.
There's a point to be made for that. So.
Yeah. It just depends. Yeah, it depends on the person. Depends on their confidence in their dentist, or if they want to move on to a different dentist.
So when that transition occurs, though, typically we would request the X-rays and some records from the pediatric office, so that we have a background of the treatment they've received, and that way it makes that transition a little bit smoother. So.
You don't want to make it. You don't have a clean break.
Right.
Know the history.
There's got to be some communication between their office and ours, and so we like to be up to speed whenever we see that new patient. So.
I think that pretty much covers it.
Yeah. Okay, so that's a wrap for another Ben and Gary show. We know dentistry, so thanks for your questions and keep them coming.
Thank
and
you.
Have a great weekend.